Hi, let's talk about the pharynx. In this video, we'll discuss the boundaries, contents, muscles, vasculature, and the innervation of the pharynx. The pharynx, or colloquially referred to as the throat, is a common aerodigestive pathway. So this is a space through which air, food, and beverage stuffs can be moved. And it's divided into three subspaces. There's the nasopharynx, the oropharynx, and the laryngopharynx. So let's start superiorly and work our way down or distally. So the nasopharynx is the superiormost element of the pharynx. It is contiguous anteriorly with the nasal cavity. And the boundary between the nasal cavity and the nasopharynx is the choana, or plural, choani. These are the internal nares, the passageways through which air is going to move between the nasal cavity and the nasopharynx. We'll have a better look at this in a posterior view. The nasopharynx continues on posteriorly. If you are to draw a line through the soft palate, so there's the bony palate or the hard palate, and then the soft palate, to continue that line, that's the inferiormost border of the nasopharynx, or the superior border of the oropharynx. So the oropharynx is contiguous with the oral cavity. The tongue rests in both the oral cavity and the oropharynx, so this would be the anterior 2/3 of the tongue, and then here is the posterior third of the tongue, and that's the pharyngeal part of the tongue. Anyways, the boundary between the oral cavity and the oropharynx is the palatoglossal fold. Together, each fold contributes to the palatoglossal arch. So that's the passageway between the oral cavity and the oropharynx. The oropharynx is divided from the laryngopharynx by both the epiglottis, which is here, and the pharyngoepiglottic fold. So that separates those two spaces. And that laryngopharynx is contiguous distally down to about the inferior margin of the cricoid cartilage. That's about at C6. So at that region, that laryngopharynx is contiguous with the esophagus. Anteriorly, there is the laryngeal inlet. That laryngeal inlet, once we cross over that boundary, we're then within the cavity of the larynx. So let's take a look at some of the contents of the various regions of the pharynx. So let's start with the nasopharynx. Superiorly, there in the mucosa is a collection of lymphatic tissue called the pharyngeal tonsil, or the adenoid. The pharyngeal tonsil is at its greatest mass early in childhood, and then it atrophies over time. So it's unlikely, if you're in a cadaveric lab dissecting, that you'll see a pharyngeal tonsil. Pharyngeal tonsil is also known as the adenoid. Singular, there is but one of these. People love to say adenoids, but there is only one pharyngeal tonsil. And moving inferior from that, we can see that there is an opening for the pharyngotympanic tube, also known as the auditory tube or the eustachian tube. This is a passageway between the nasopharynx and the middle ear, and it's a way by which pressure can equilibrate within the middle ear. So if you've ever had your ears pop, as you've changed altitude or perhaps even depth if you're in the water. That's the sensation of air moving through the pharyngotympanic tube. Moving down to the oropharynx, the uvula, which is the extension of the soft palate here, is within the oral cavity. Anteriorly in the oral cavity, if you recall, there's the palatoglossal fold there. The posterior aspect here of this region is the palatopharyngeal fold. So these two folds prescribe a space called the fauci. The fauces is Latin for throat. And so the fauces here is just this space, and within the fauces is a tiny little depression called the palatine fossa, and it's within this depression that the palatine tonsil can be found. When people say that they've had their tonsils removed, very frequently they're referring to these palatine tonsils. You may or may not see lymphoid tissue in a cadaveric photograph, but if it is present, it would be there within the fauces here. Let me just spell fauces for you. So, fauces. That's the anterior portion of the oropharynx, and it's also in association with the fauces that we have the root of the tongue, also known as the pharyngeal part of the tongue, and it's on this portion of the tongue that we have a collection of lymphoid tissue known as the lingual tonsil. So it looks rather rugose, and you may see that there. From time to time, you'll hear folks, including myself, refer to various folds. These folds are basically, generally, a muscle that has been invested by some of the mucosa. So when the mucosa wraps around that muscle, it creates a fold. So this anterior fold, that palatoglossal fold, is the palatoglossus muscle surrounded by mucosa. The palatopharyngeal fold is the palatopharyngeus muscle surrounded by mucosa, and so on and so forth. Sometimes folds can be ligaments surrounded by mucosa as well. One thing that we can't see here are the epiglottic valleculae. These are spaces between the epiglottis and the tongue that serve as traps for saliva. So this epiglottis is really far anterior, but if it were more in a resting position posterior there, we would be able to see those epiglottic valleculae. Now, we've talked a little bit about masses of lymphoid tissue. These are all malt tissue or mucosa-associated lymphoid tissue, and they form a ring about the airway throughout the pharynx called Waldeyer's ring. Waldeyer's ring consists of malt tissue from both the nasopharynx and the oropharynx, and if we were to prescribe a circle about this, or a ring, we would see that at the superior portion of this, so at 12 o'clock, we would have the pharyngeal tonsil. At 6 o'clock, we would have the lingual tonsil. And then, maybe somewhere around 1 or 2 o'clock, the tubal tonsils. Those are associated with the pharyngotympanic tube openings. And then, maybe somewhere around, 5 and 9, the palatine tonsils. And so these are found through the nasopharynx and the oropharynx. And the division between them would be that line going through the soft palate. Again, because these regions are part of a common aerodigestive gateway, this is a potential pathway for pathogens to enter. And those pathogens, when they come up against this malt tissue, offer the immune system an opportunity to encounter these pathogens so as to prime themselves for being able to deal with the pathogens. Moving distally, we have the laryngopharynx. The laryngopharynx is going to contain the epiglottis, which is the epiglottic cartilage of the larynx, invested by mucosa. Its anterior boundary here is going to be that laryngeal inlet for the laryngeal vestibule. There's also the opening for the esophagus, so that's the point at which the laryngopharynx becomes the esophagus, at the inferior margin of the cricoid cartilage, or about C6. And one thing that is within the laryngopharynx that we can't see in this particular view are the piriform recesses. Those would either be superficial or deep to this, but we will see those in the posterior view. Promise you. And let's take a look at that now. So here is a posterior view of the pharynx that has been opened up. So along this margin, along the pharyngeal raphe, we've made a cut and we've reflected the muscular walls of the pharynx laterally. So the nasopharynx, here are the choanae. There's one choana. There's the other choana. So in here is the nasal cavity. There's the other nasal cavity, and that nasal cavity is divided by the nasal septum. We can also see the opening for the pharyngotympanic tubes there and there, and we see a nice soft palate along here. So that soft palate is going to be the dividing line between the nasopharynx and the oropharynx. So here's our oropharynx. We really can't see the palatoglossal arch. That's going to be up there, but we can see the root of the tongue here and the uvula. Here is the pharyngoepiglottic fold right along there, separating the oropharynx from the laryngopharynx, inferior to that. We can see the larynx, so I'll outline the larynx for us here. That larynx would normally be invested with mucosa, but all of the mucosa has been stripped away. Oops, I should have gone wider to include the thyroid cartilage of the larynx there. And the piriform recesses that I was discussing are lateral to the larynx, there and there. So those are spaces in which food can get caught on its way down. So below the cricoid cartilage there, we would open up into the esophagus. So this is a nice view, and this is a view that we would encounter during our dissection of the pharynx and the larynx. So let's take a look at the posterior wall of the pharynx here. So here is the base of the skull, and I can see from that base of the skull there's some pharyngobasilar fascia on either side. The pharyngobasilar fascia is investing the deep part of the superior pharyngeal constrictor. The pharyngeal constrictors are probably the most conspicuous parts of the pharynx, looking at it posteriorly, and they look like a set of nesting cups. So there's the superior pharyngeal constrictor, there's the middle pharyngeal constrictor. They're not always this obvious, and then below that is the inferior pharyngeal constrictor. All of these pharyngeal constrictors are paired, and they meet their counterparts along that midline pharyngeal raphe. They originate on elements of the skull for the superior pharyngeal constrictor, the hyoid bone for the middle pharyngeal constrictor, and elements of the larynx, both the thyroid cartilage and the cricoid cartilage, for the inferior pharyngeal constrictor. The pharyngeal constrictors serially constrict the larynx, and then there are also 3 pairs of longitudinal muscles. These are more obliquely oriented, one of which we can see here. This is the stylopharyngeus muscle coming from the styloid process of the temporal bone down to the thyroid cartilage. These longitudinal muscles elevate the larynx, and when they do that, they both foreshorten and widen the pharynx. So they enable the pharynx to get larger and shorter so that foodstuffs can be moved along. So let's take a look at these sets of muscles side by side, and we'll get into the particulars of each set. But on the left side here, we have the pharyngeal constrictors, and we can see that superior pharyngeal constrictor, which is located here, is associated with the skull, so both the cranium and the mandible, whereas that middle pharyngeal constrictor is associated with the hyoid bone, and the inferior pharyngeal constrictor associated with the thyroid and cricoid cartilages of the larynx. The longitudinal muscles include that stylopharyngeus muscle there, and we can see that better here as well as salpingopharyngeal muscle. Salpingopharyngeal muscle. Salpinx means horn, and that's the horn of the pharyngotympanic tube. That's where that muscle is originating from. And palatopharyngeus originates from the bony plate and soft palate. And salpingopharyngeus and palatopharyngeal fibers blend together on their way down to the wall of the pharynx and the thyroid cartilage there, but we'll see that in greater detail in just a bit. First, let's start with those pharyngeal constrictor muscles. So the superior pharyngeal constrictor muscle originates on the skull. There are several parts to it. So there's the pterygopharyngeal part that originates on the medial plate and the pterygoid hamulus, which is there. There's a condensation of the buccopharyngeal fascia called the pterygomandibular raphe. Pterygoid mandible, pterygomandibular raphe. The pterygomandibular raphe runs between that pterygoid hamulus and medial plate down to the mylohyoid line. And so the pterygomandibular or pterygopharyngeal part of the muscle originates there, and then there's the buccopharyngeal part of the muscle, which originates from that pterygomandibular raphe. Then there's the myelopharyngeal part of the muscle originating from the mylohyoid line of the mandible. And then there's also a part that we can't see the origin for it, called the glossopharyngeal part, that actually starts at the tongue. Isn't that fascinating? So 4 parts to that superior pharyngeal constrictor muscle: the pterygopharyngeal part, the buccopharyngeal part, the myelopharyngeal part, and the glossopharyngeal part. And we can see that all of those names give us a great clue as to what that part is originating from. The middle pharyngeal constrictor originates from the hyoid, and then it goes back to the pharyngeal raphe. So there's the middle pharyngeal constrictor. And then the inferior pharyngeal constrictor has 2 origins. There's the thyroid cartilage part and the cricoid cartilage part. So we have the thyropharyngeal and the cricopharyngeal parts of the inferior pharyngeal constrictor. And we'll see how that cricopharyngeal part actually has a very interesting series of innervations. Very cool, and we'll talk about that in just a little while. So moving on to the longitudinal muscles, the stylopharyngeus is going to be the only one that we can see with the posterior wall of the pharynx intact. And this is an important muscle as a landmark because it's going to insinuate itself between the superior and middle pharyngeal constrictors. We can see there's the hyoid bone, that's the greater horn of the hyoid that the middle pharyngeal constrictor will be associated with. So you can sometimes palpate that hyoid bone to feel for where the middle pharyngeal constrictor is. But in order to see the other longitudinal muscles, we would have to incise and then reflect and then remove the mucosa so that we can see the salpingopharyngeus and the palatopharyngeus, but these are going to blend together in the wall of the oral and laryngopharynx to be one muscle, eventually going down and inserting into the thyroid cartilage so that it can elevate the larynx. So let's talk a little bit about the pharyngeal plexus. This is a neural plexus that has three major constituents, but let's start with the efferent portion of this plexus. The efferent portion of this plexus is mostly cranial nerve 10, the vagus nerve. So recall the vagus nerve exits through the jugular foramen. Here is one of the ganglia of the vagus nerves there. And we can see it sending branches posteriorly. So these are going to be efferent branches participating in that pharyngeal plexus. There are a couple of exceptions to the vagus being the main efferent to this, and that is that 9, the glossopharyngeal nerve, is going to efferently serve the stylopharyngeus muscle. And there's a very classic anatomical relationship between the stylopharyngeus muscle and cranial nerve 9, that being the cranial nerve 9 as it exits the jugular foramen is going to ride the stylopharyngeus muscle down between the superior and middle pharyngeal constrictor muscles. So please do look for that nerve there. And then finally, the cricopharyngeal part of the inferior pharyngeal constrictor not only is going to be efferently served by the vagus nerve of the pharyngeal plexus, but it will also be served by the external branch of the superior laryngeal nerve, as well as the recurrent laryngeal nerve. And we can see elements of the recurrent laryngeal nerve coming up to efferently serve that cricopharyngeal part of the plexus there. So that's the efferent part of the pharyngeal plexus. Let's discuss the afferent, or the sensory part of the plexus. So in terms of the afferents, it's cranial nerve number 9, or the glossopharyngeal nerve. We can see that sending those afferent branches down to the pharyngeal plexus there. An exception to this is that the nasopharynx does not get its afferents from the pharyngeal plexus. The nasopharynx is actually innervated by the pharyngeal branch of the maxillary nerve, or V2. The sympathetic contributions to the pharyngeal plexus come from the superior cervical ganglion of the cervical sympathetic trunk. It's probably important to note that this pharyngeal plexus is also serving the muscles of the soft palate. So it will serve all of those palatal muscles with the exception of one muscle, tensor veli palatini. Tensor veli palatini is served by a branch of V3, which is the mandibular division of the trigeminal nerve. So now that we understand these constituents of the plexus, vagus, glossopharyngeal, and the superior cervical ganglion, let's talk a little bit about the gag reflex, or the pharyngeal reflex. So if you've ever experienced the gag reflex, you probably immediately understand what I'm talking about. A reflex is an involuntary response to a stimulus, and that stimulus might be touching the root of the tongue, or the soft palate, or the posterior wall of the pharynx. So if you think of someone sticking a finger into their throat, that would be the stimulus. The stimulus is going to be detected by the afferents here. And the afferents would be glossopharyngeal, cranial nerve number 9, and that's going to send a message back to the brainstem, where it will be integrated, and the brainstem is going to send out a response via the vagus nerve to the pharyngeal muscles, and it's going to cause those pharyngeal muscles to constrict. So the gag or pharyngeal reflex is a protective reflex, such that when something unexpected enters into the pharynx contracts so as not to choke on that unexpected item. Interesting thing about this gag reflex is if you look at the literature, a third of people have what's known as the gag reflex. A third of people have no gag reflex, and then another third of people have a hyper gag reflex. A hyper gag reflex would bring into bear additional musculature that may lead to an emetic or a throwing up event. So probably, I guess, best to not be in that hyper group, either to have or to have not, but to not have an exceptionally robust gag reflex. And that leads us to our assessment question here, and that is, Waldeyer's ring is a collection of mucosa-associated lymphatic tissue, MALT tissue, encircling the oropharynx and which other contiguous region? Is it the esophagus, the laryngopharynx, the nasopharynx, the oral cavity, or the trachea? Well, Waldeyer's ring, if we were to draw it for ourselves, like so, would have the pharyngeal tonsil, the lingual tonsils.
Sorry, I'm not sure about that.
Palatine tonsils, and the tubal tonsils. And so this would be the oropharynx, and then this would be the nasopharynx, separated by the soft palate. So the correct answer would be C, nasopharynx. Thank you very much for your time, and pardon the Alexa interruption.